The indications for the King LT airway are the same as the indications for the combi tube. Cardiac arrest from any cause, respiratory arrest with no gag reflex, and an unconscious patient who is not breathing adequately and has no gag reflex. Contraindications: any patient who is under 4 feet tall, patient who has an active gag reflex, patient who has known or suspected esophageal disease like esophageal varices, a patient who has a history of ingesting caustic substances, patient who has a known or suspected foreign body airway obstruction, and a patient with a tracheostomy or laryngectomy. We will carry 3 sizes of the King LT airway, sizes 3, 4, and 5. Size 3 will be kept in the ambulance compartments, not in any bags, similar to the combi tube SA or small adult. The size 3 King LT is for patients between 4 and 5 feet tall. As you insert it, your initial volume in the cuff will be 50 milliliters. You can insert to a maximum of 60 milliliters. Sizes 4 and 5 will be kept in the green bags and the blue bags to be used as a backup airway if endotracheal intubation fails. Size 4 is for patients between 5 and 6 feet tall. Initial volume in the cuff is 60 milliliters of air. You can max out at 70. Size 5 is for patients over 6 feet tall. Initial volume in the cuff is 70 milliliters. You can max out there at 80. The King LT airways are packaged individually and each have 4 different things in the packaging. First is the tube. They're labeled with the size and the color code at the tip. They also have a 60 cc syringe for inflating the cuff, lubricating jelly, which I recommend that you use on all the patients, and a quick reference card that will provide you with sizes of patients that this tube can be used on and volumes of air to be used. Once you've decided to use the King LT airway, first pre-oxygenate your patient with 100% oxygen. When you are ready to insert it, lubricate the distal end with a lubricant that comes in the package. To insert the tube, start at the corner of the mouth. Insert very similar to inserting a combi tube, almost all the way to the hub. Once you're in, this is a size 4 tube for a patient between 5 and 6 feet tall. The initial volume is 60 milliliters of air. Once you have inserted the 60 milliliters of air, ventilate the patient and have your partner check breath sounds with the stethoscope. The breath sounds will be distant, so as you are ventilating the patient, slowly retract the tube until the breath sounds become more prominent. Once the breath sounds are more prominent, add another 10 milliliters of air into the cuff. And reconfirm breath sounds. The tube can be secured in place with a common Thomas ET tube holder, and it is also appropriate to use end-tidal CO2 just as you would on an endotracheal tube.